Effects of not completing your prescribed dose of antibiotics. My name is Dr. Libeya Bethwel, a community pharmacist practicing at Fortizo Pharmacy in Nairobi West, and I would like to break down the effects that not completing your prescribed dose of antibiotics has on your body. Bacteria are foreign intruders, and when they intrude your body, they cause diseases. And these bacteria, though they could be identical, but they have varying degree of susceptibility or sensitivity to the antibiotics that perhaps your doctor has given you to use. And so this bacteria, on one end of the spectrum, we have the weaklings, or those which are weak and they can easily be killed by mild doses of antibiotics. And these weaklings, they get killed the first few days when you take the antibiotic. And then in the middle, we have what I'll refer to as the middlemen. These are neither strong, or they are neither strong nor are they weak. They're just in the middle. And then on the other end of the spectrum, we have the resilient bacteria, which are unresponsive to mild doses of antibiotics. And so when you begin to take your antibiotics, the first few days, the weaklings get eliminated, and the middlemen, or the bacteria in the middle of the spectrum, they get weakened. So when you get to day 3 or day 4 of taking your antibiotics, the middlemen, most of them, or the bacteria in the middle of the spectrum, most of them get eliminated, and so you begin feeling well. Here is where the trap lies. Many people, when they begin feeling well, they think they have eliminated all the bacteria in their body, and so they discontinue their antibiotics. At this particular level, day 3 to day 4, only the majority of the middlemen have been eliminated. But remember, we have the unresponsive and the resilient bacteria at the end of the spectrum. This bacteria can only respond to strong doses of the antibiotic. And so if you discontinue your antibiotic day 3 or day 4 when you feel better, then you've not completely eliminated all the bacteria from your body. And so what happens? Since you've eliminated the weaklings, you've eliminated the middlemen, then you're remaining with the resilient and unresponsive bacteria, then it means they have room to multiply. They have food that they can get in the body from your cells. And so because there's no competition with the weaklings or the middlemen, so the resilient bacteria, the unresponsive bacteria, the ones that are unresponsive to mild doses of the antibiotic, have room to multiply. And so when relapse happens, then the disease gets worse, because this resilient bacteria, number one, they've multiplied. Number two, they've built resistance because they've been exposed to mild doses of the antibiotic. Then they built resistance against that antibiotic, so they cannot be eliminated by that antibiotic. And that is what we call antimicrobial resistance. So if you don't take the full course of the dose that has been prescribed for you, then you are setting up yourself for such a scenario where you become resistant, or the bacteria in your body becomes resistant to antibiotics that would have worked, or would have worked in your case. And so I would like you to always purpose to take the full course of the antibiotics that are prescribed for you. And by that, you'll be helping us to fight antimicrobial resistance. And by that, we'll be advancing the fight against bacteria or diseases that are caused by bacteria. Thank you so much.